So, Assalamu alaikum. I hope so. You all are fine and doing very well. So, today's our topic is salivary gland disease, and it will be basically divided into three lectures. And I will try to make it as simpler as possible for you guys to understand it. So, let's start with the name of Allah Almighty. Now, what will be our learning objective today? Basically, we will first define the salivary glands, then we will classify the salivary glands as well, and then we need to recall a little bit anatomy and function of salivary gland that you guys have already studied in your oral medicine and oral biology, I think so, in first year and third year as well. So we will just recall a little bit of anatomy and function of salivary glands, and we will also discuss the diagnostic modalities for salivary gland disease because these are very much important and they can be asked in your exam by the external examiner in your viva as well as in your theoretical exam papers as well. So now starting with the definition of salivary glands, basically it is an exocrine gland that secretes saliva. You should know that there are some glands present in your oral cavity which secretes saliva, and such a gland is known as basically the exocrine gland, and they are called as basically salivary glands. So the saliva is always secreted by exocrine gland. Do note it because an MCQ can come and it can be asked if saliva is secreted by salivary glands, which type, like endocrine or exocrine. Basically, an exocrine gland secretes saliva. Okay. Now, moving forward, salivary glands are basically classified in two groups. So this is the important classification. You need to know the classification of salivary glands. They are basically divided into two major groups, which include major salivary glands and minor salivary glands. And minor salivary glands are about like 800 to 1000, and it can vary from person to person and uh, from human to human basically. Okay, so there are two types of the salivary gland. One is major salivary gland, and then and the other is minor salivary gland. And minor salivary glands can be vary from 800 to 1000. Now, the classification of the major salivary glands includes it is basically subdivided into parotid gland, submandibular gland, sublingual. So major salivary glands are basically three, and they are always present in pair. Do note because it can come in your exam that how many there are salivary glands. So basically there are 12 uh, salivary glands. So basically there are 12 salivary glands, and they are basically sorry, uh, not 12. There are basically six salivary glands, major salivary glands. When not asked in pairs, when there are three pair of major salivary glands, which includes parotid, submandibular, and sublingual. Now moving towards the minor salivary glands. Minor salivary gland basically except the anterior third of the palate and attach gingiva and dorsal surface of the anterior third of the tongue. In these three locations, basically they are not present. However, they are present throughout the oral cavity. You can see that they are present on the labial side. They are present on the buccal side. They are also present on your palate, and so these are side, and they are also present on tonsillar side also, where they are known as Weber's glands, and on the retomolar, they can called as Corman's glands as well. And they are also present on lingual side. So do remember, minor salivary glands are present throughout the oral cavity, but they are not present on the anterior third of the palate basically, and on the attached gingiva and on the dorsal surface of the anterior third of the tongue. So these are the three exceptions where the minor salivary glands are not present. This can come into the exam and we can be asked where the minor salivary glands are present, except so you need to know they are not present on the anterior third of the palate, attached gingiva, as well as the dorsal surface of anterior third of the tongue. Now, looking towards the structure of the basically salivary glands, you should know that in the oral cavity, salivary glands basically duct are made up of there are striated ducts, there are intercalated ducts basically, and there are three things you need to know. First, you need to know the epithelial layer. Then you need to know the ducts, which type of ducts basically are, and which type of cells are basically present in them. Basically, the two types of cell you will see. There is myoepithelial cells, which are very much important for the contraction, and there are acinar cells that help in producing the saliva, and then you have intercalated ducts as well and striated ducts. So ducts are very important because they will let the saliva travel through. right? And the cells, acinar cells, the myotic cells, basically they will contract and produce your saliva, and they will move it towards the ducts, and from ducts it will go towards the epithelial surface, which is basically lined by the stratified squamous, and basically the striated ducts leads to the extralobular duct, which then leads into the oral cavities, and from here the saliva is passed. So firstly, the acinar cells have basically produced the saliva. Myoepithelial cells, contracting cells have contracted the saliva and then move it towards the intercalated ducts. The intercalated ducts then move it towards the striated duct, and from striated duct it goes into extralobular ducts, which ultimately lets into the oral cavity, where the epithelium is basically lined by the stratified squamous. Okay. Now, moving towards the parotid gland, basically parotid gland is a very much important gland. Uh, why? Because basically it is present superficial to posterior aspect of masseter muscle and ascending ramus of the mandible. So you will basically see it on the superior, superficial, and also posterior aspect of the masseter muscle. So it is basically present superficial and and on the posterior aspect of the masseter muscle, which is one of muscle of mastication, and on the ascending ramus of mandible. And the picture will come in the yes, as you can see here. Basically, this is the parotid gland, and you can see here that that if this is a parotid gland, basically this is a masseter muscle. So it is present superficial, like it is present on above here on the masseter muscle, and it's present basically push on the posterior aspect. If this is a masseter muscle and it's present basically posterior aspect of it. So this was basically the location of it, and it is present on the basically interior of the ramus. Like if this is the ramus of the mandible. Okay, I hope so. You got my point where it is located. Acha. Now, it has basically major branches of the facial nerve divides the gland into superficial and deep lobes. So you might have seen and studied that in anatomy the facial nerve also passes through the parotid glands. Basically, the facial nerve divides the glands into superficial and into deep lobes. Okay, so major duct of the parotid glands is Stinson duct. So basically, this is a $100 MCQ if anyone can ask a question as well, what is the major duct of the parotid gland? So you should know that the major duct of the parotid gland is in Stevenson, Stenson duct. Okay, so this is the basically name. So do remember the name very much well, because anyone can ask you in exam or viva, or this can come in your MCQ as well. So how much it is in diameter is basically 1 to 3 millimeter in centimeter in diameter and 6 millimeter in length. And now the other thing that you need to be asked in the exam is where does the ducts open in the oral cavity? The duct of the parotid gland basically open through the buccal mucosa. You should know that it opens through the buccal mucosa adjacent to the maxillary first or second molar. So the major duct of the parotid gland is basically Stenson duct, and it opens uh, through the buccal mucosa adjacent to the first and second maxillary molar. So you should remember that as well. Okay, this is the basically parotid gland. You can see here its location basically is on the superficial and posterior aspect of the masseter muscle here, and on the ascending ramus of the mandible here, and then basically this is the mandible here. You can see that this is if this is a mastoid process here. You can see then this is basically auricle and this is zygomatic. So this is letting you know about the location of the parotid gland. So this is the parotid duct. Here you can see that this is a duct basis being going from the parotid gland moving outward, and this parotid duct is known as the Stenson duct, as you know that. And you can see there is a little bit accessory parotid gland as well, and this is your parotid gland we were talking about. So this was basically the anatomy of the parotid gland. So here you can see that this is a parotid gland. It has basically two lobes which are being divided by the facial nerves. The facial nerve is basically being coming from here and is dividing into superficial and deep lobe. Basically here you can see there the facial nerve has a lot of branches: temporal branch, zygomatic branch, buccal branches, mandibular branches, and cervical branch as well. Okay. Now this was all about the parotid gland and anatomy and its function. Then we have submandibular gland as well. The submandibular gland is basically located in the submandibular triangle of the neck, which is formed by the anterior and posterior parallels of digastric muscle and inferior border of the mandible. So basically, submandibular gland is located in submandibular triangle of the neck. Do remember its location. It is present in the submandibular triangle of neck. It can be asked, and it is basically formed by the anterior and posterior bellies of the digastric muscle and inferior border of the mandible. Okay. So basically, a duct passes forward close to the lingual nerve, which loops under the duct from the lateral to the medial. Ducts open into oral cavity through punctum or the lingual plenum and close to the incisor. So you might have noticed here. I will let you know with the help of diagram that, but do remember that when you see the oral cavity uh, of a patient, you can see that if this is if this is mouth and this is the tongue. So basically, it will be its duct will open to a punctum located near his incisors, mandibular lower incisor, because we are discussing about submandibular gland. So it will be present here like this, and its punctum will open near the lingual frenum. Do you know that what is lingual frenum? Uh, so basically, uh, its punctum will the gland punctum will basically open near close to the lingual frenum, which will be basically close to the incisor. So punctum is constructed portion and prevents retrograde flow of oral fluids. Basically, the punctums are basically small openings which are being very much constricted, and they prevent the retrograde flow, like backflow of the oral fluid with saliva, to prevent the bacterial load laden. Okay, so basically, a duct is 5 centimeter in length and 4 millimeter in diameter. Do remember these for the MCQs, because you don't know whenever you can be asked in the exams as well. So this is basically the mandible. This is thyroid, posterior belly of the gastric, this side bone, and this is anterior belly of the gastric. So as I told you, it is present between the anterior and posterior belly of the gastric muscle. It is basically formed here, and it will be present in the submandibular triangle, like here. You can see that this is present in submandibular triangle. Okay, and there are a lot of things around it, which so you need to know think basically about this muscle. It has basically duct, and its duct is known as uh, Wharton ducts. This can be also asked. Or sorry, uh, its ducts is known as Bartholin ducts. Yes, and and if it is divided into smaller number of ducts, then they are 8 to 20 ducts, and these are called duct of Ravenous. So you should remember these for the exam as well. So this is your submandibular gland is present, basically located in submandibular triangle of the mandible, and it basically is located between an anterior posterior vertebral digastric. Here you can see that it is also divided into two lobes, basically superficial part of the mandibular gland, deep part of the mandibular gland, and there is a duct which is known as Bartholin duct, which can be asked in your exam, and as well as if there are 820 ducts, then there are ducts of Ravenous. Okay, so basically the duct opens near the lingual frenum, close to the mandibular incisors. Now you can see the picture of the anatomical picture here. So this is basically submandibular gland. You can see that the lingual nerve is above passing here. Below there is a myeloid muscle, and then there is head bone as well. So if you have multiple sublingual ducts, these are called duct of Ravenous. And if there is single duct, then there is a Bartholin duct. So you can see that basically it's located on superior surface of the myeloid muscle. As I told you that if this is a myeloid muscle, so it is located above the myeloid muscle, and in the sublingual space basically, and have overlying thing there of mucosa as well. So there are acinar ducts which is named as Bartholin duct, basically that produce saliva, and there are 8 to 20 ducts of Ravenous as well. So they open directly into the oral uh, maxilla on the oral cavity on the crest of mucosa known as pilica sublinguus, or indirectly through a connection with submandibular duct. So they can open directly as well as indirectly, depending upon their location and their function. So here we have the functions of saliva, which are very much important, and I expect that you do remember these because they you are being studied from the first year uh, in the oral biology. So first we discuss about anatomy and the definition of saliva as well as its classification. Now we are discussing about the saliva function. These are very much important. You should remember the functions, the names as well. The first function is the foremost important, the protection. Basically, saliva protect you in a way that it basically flushes away the non-adherent bacteria, and then it lubricates and prevents basically the oral tissues from adhering to one another. So basically, it is also providing you the lubricant effect as well, and it is preventing the oral tissues from uh, being adhering together. Then there are mucin basically which act as a barrier against the microbial toxin and minor trauma to oral mucosa. That is very much beneficial for you. Do remember that there are mucin which act as a bacteria or a barrier against a microbial toxin and minor trauma to the oral mucosa. Then it's one of the most important functions is that it also helps in digestion. How that amylase and lipases begins the digestion process. Basically, there are enzymes like amylase and lipase. Amylase helps you in digestion of the all the starch and carbohydrates, and the lipases basically they help in the digesting the lipid foods, and the which will help you in the digestive process basically. Then we have antimicrobial action as well. So there are a lot of enzymes that do perform antimicrobial action, which include lysozymes, lactoferrin, perioxidase, and statins, because and as they have antimicrobial activity. Then you have salivary immunoglobulin also present, and this can be asked in your exam as well. That what is the name of the immunoglobulin, which is basically present in the saliva. So do remember that IgA is basically the immunoglobulin which is present in your saliva, and it is basically the agglutination of microorganisms and prevents their adhesion to oral tissue. So it doesn't lead the microorganisms to adhere to the oral tissue. Salivary immunoglobulin IgA. Then it also helps in you to taste. Basically, how does it help in taste? It basically provides taste by solubilizing the food substances so that they can be sensed by the taste receptor in the taste bud. So it helps you to sense the taste receptors in the taste buds. Their food can be tasted by this, and it also helps you to form a pellicle formation, which is a very important layer thin film of the salivary protein which bind to the teeth surface, binds calcium and protect the tooth surface. So it basically is providing protecting the tooth surface, and it also helps in binding calcium. And it is what is the pellicle, basically thin film of salivary protein that bind to the tooth surface. Then it has also a very much important function which is known as buffering. So what happens is buffering basically, you can see that in buffering we have bicarbonate and phosphate ion. So what happens that buffering basically prevents demineralization of the teeth by bacterial acid. So when you take any acidic food or any high intake of acids, what happens is all the minerals in your teeth are basically demineralized, and then you will show the signs of decay or other things. So basically, it prevents demineralization, and it also helps in maintenance of tooth integrity and tissue repair. So this is very much important function, or these are the very much important functions of the saliva. So now we will discussing basically the salivary flow rate. So in the salivary flow rate, you should know that salivary flow approximately a day is 1000 to 1500 ml per day. Okay, so approximately a person in a day, the saliva flow rate is basically 1500 ml per day. This can be asked in your MCQ. Then for submandibular gland, there is 70 to 70% of saliva. So basically, submandibular gland is the gland that produces most of the saliva. So this can be asked in your exam as well. 70% of saliva is produced by which person of which gland? Basically, the submandibular gland produces 70% of saliva. Then 25% of the saliva is being produced by the parotid gland. Okay, and for the sublingual, there is 3 to 4% uh, uh, saliva is being produced by the sublingual gland. So I hope I think so that we should keep today's lecture to this slide, because from the next slide, diagnostic modalities are being started. I would love to cover this in today's lecture, but I think so that today we should just recall basically the anatomy and the just function as well as the classification, and we should stick to towards just the basics. Basically, the today's lecture was to recall a little bit about anatomy as well as function. And from tomorrow, inshallah, we will starting diagnostic modalities, which are a lot like OPG and cylography, and we will be discussing a little them in details and application of cylography, etc. So, inshallah, see you tomorrow with this diagnostic modalities of the salivary gland. So again, thanks for being here and watching. If you do have any question, do let me know in the comment section. Thanks again. Khuda Hafiz.